So enter the room. The scene is safe for me to approach the patient. I'm going to do the 7 steps of hand hygiene. Palm to palm, back of the hand, fingers interlace, fingers interlock, tips of the fingers, thumb rotation, and wrist rotation. Good morning, my name is Tess. I am your nurse for the day and I will be doing a set of observations with you. Is that okay?
Morning.
Yeah?
Fine.
Okay. So before we start, I would like to ask some information about you first. Is that okay with you?
Yes.
So I will just grab your wristband. Can you please tell me your full name and your date of birth, please?
Mary Kalanusa, 21, 1983.
I can confirm that the information is correct with the hospital number of 321654, both on the wristband and on the paperwork. So Marinka, can you please tell me if you have any allergies?
I have some intolerance for the lactose.
So what kind of reaction do you usually have when you take lactose?
I get some bloating of my tummy.
Okay, that's too bad. So I'm going to ensure during your stay here that you won't have any food that contains lactose. Is that okay with you?
Sure.
And I can also see that you've got the wrong wristband. It's supposed to be red to indicate that you have an allergy. So
Okay.
after the procedure, I will change it to a red one. Is that okay?
Yeah, sure.
Okay, that's good to hear. So Marika, are you experiencing any pain as of the moment?
Yes.
Where's the location of the pain?
Oh, I could say my left ankle.
Oh, I can see that you have fractured your left ankle. Is that it?
Yeah.
So if you're going to score your pain with a numerical pain score of 0 to 10, with 0 as none and 10 as the highest, how much is your pain?
I could score 5.
Okay, that's a considerable amount of pain. Do you want to have any analgesia?
Yes, please.
So what I'm going to do is that after the procedure, I will check on your MAR chart. If you have any prescription for pain medication, I will give it to you. If there's none, I will inform your doctor about this. Is that okay?
Thank you.
Okay, are you comfortable with your position?
Yeah.
Do you need anything as of the moment?
No.
So the procedure will take at least 10 to 15 minutes. Do you want to go to the bathroom now?
No, just use the washroom.
Okay, that's good to hear. So I'll be starting with my procedure. First, I'm going to wear my PPE. So I'm going to do the 7 steps of hand hygiene first. I can confirm with the examiner that the equipments I'm going to use are clean and calibrated. And I'm going to wear my apron and my gloves. My gloves are clean and intact and the expiry date is 2025. So I'll be filling up the patient paperwork first. The name of the patient is Marinka Lanusa. Hospital number is 321654. The date is today and the time is 10 o'clock. So first, Marinka, I'm going to assess your Glasgow Coma scale. So for the eye response, upon entering the room, you were able to open your eyes immediately and react to me. So I'm going to score you a score of 4, which is spontaneous. The next one will be the verbal response. So Marinka, I'll be asking you 3 questions. Is that okay?
Yeah.
So can you please tell me your full name?
Mary Kalanusa.
And do you know where you are at today?
I know it's a hospital, but not sure the name.
Oh yes, you are in the hospital and the hospital's name is Musgrove Park Hospital.
Okay.
Okay, and do you know what year it is, Marinka?
2020.
No, Marinka, I'm sorry, but it is 2021 already.
Oh.
And yes, I can see that you are a bit confused, so during this time, I will come back once in a while to remind you. Is that okay with you?
Fine.
So I'm going to score Marinka a score of 4 because she wasn't able to answer all of the 3 questions correctly. The next one I'm going to assess, Marinka, will be your best motor response. So I'll be asking you some simple commands. Is that okay with you?
Yeah.
Can you please put the tip of your fingers to the tip of your nose? This one? To the tip of your nose.
Like that?
Yes, like that. That's it. Thank you. Marinka was able to obey commands, so I'm going to score her a score of 6. Marinka's GCS is 14, which is 1 point lower than the normal value. The next one I'm going to do, Marinka, is I'll be assessing your pupil size and reaction. So first thing, I'll be assessing the pupil size. I'll make sure that I have enough light to check the pupil size and I'll compare it to the pen torch that I'm using. I can see that the size of your pupil is 4. And Marinka, During this assessment, I would like you to look at the tip of my nose. Is that okay? So, the next thing I'm going to do will be assessing your pupil reaction. I'll be shining a light from the outer side of your eyes to the inner side, one at a time. It will be a bit uncomfortable, but I want you to bear with me. Is that okay?
Okay.
So, I'll be shining the light from the outer canthus to the inner canthus, one eye at a time. Look at the tip of my nose. I can see that both pupils are reactive. So the next thing I'm going to be assessing will be your limb strength and movement. I want you to raise both of your arms like this. Yes. I'll be applying pressure on both your arms and I want you to resist it for me. Okay? That's good. Both of your arms have normal power. So the next thing I'm going to be assessing will be your legs. So I'll assess your right leg first. I want you to raise your right leg and then apply pressure, resist it. Okay, normal power. And the next thing will be your left leg. I want you to raise your leg. It looks a bit weak. I'll put some pressure. Okay, so you've got mild weakness on the left leg. Okay, Marinka, so I'm done with the assessment of your pupils, your limb, and your GCS. The next one that I'm going to do will be assessing your vital signs. Is that okay with you?
Yes.
So the first thing I'll be assessing will be your blood pressure. So first of all, I'll make sure that my equipments are clean and calibrated. I want you to be seated in an upright position and I want you to be comfortable. Are you comfortable?
Yes.
Okay. I want your legs to be uncrossed during the procedure. Please uncross it for me. Thank you. And I'll be placing a pillow under your arm so that your arm will be at the level of your heart. Then I'll be remove your sleeve here to expose your arm. I can see that your arm is free from any trauma, lymphedema, or any surgery. Do you have any cannula on this arm? No, I can see that there's none. I'm happy to see that. I'll be palpating your brachial artery. I can feel your pulse here. It is strong. And I'll be using the correct cuff size for you, which is 80% of the circumference and 40% its width. I'll be placing the cuff 2 to 3 centimeters above your brachial artery with the artery index marker pointing to the brachial artery. So during this procedure, Marinka, you will feel some cuff tightening and it will be a bit uncomfortable. I hope you can bear with me, but if you can't, please tell me immediately.
Okay.
And during this procedure, I want you to remain quiet as well.
Okay.
Okay, so while waiting for my blood pressure, I'm also going to check for my O2 saturation. Can I use your other hand, Marinka? So I can see that the fingers are clean. There is no nail varnish. There are no false nails. And the capillary refill goes back in less than 2 seconds. The fingers are warm to touch. And the radial pulse is strong. So I'm going to place the probe for 10 seconds. So my O2 saturation is 99%. Just going to wait for my blood pressure. And my blood pressure is 123/80, which is within the normal value. And 99%. So Marinka, I'm done assessing your blood pressure and your O2 saturation. The next thing that I want to assess will be your pulse. I'll be palpating your radial pulse for 2 full minutes. I want you to remain quiet during this one. Is that okay?
Okay.
Okay. Okay, I'm done checking your pulse. And your pulse is 94. And your respiration is 18. So during these 2 minutes, for the first 1 minute, I check for your pulse rate, and for the second 1 minute, I check for your respiration rate. I didn't inform you beforehand because I don't want you to feel conscious when I'm checking for the respiration rate. So the next one I'm going to assess will be your temperature. I can see that you have a wound on your head, so I can choose the temporal route. What I'm going to choose will be the oral route. Is that okay with you?
Okay.
So I can confirm that my equipment to be used is clean and calibrated and it's in good working condition. So before I'm going to check for your temperature via oral, can I please check your mouth if there's any signs of infection, if it is clean, or do you have any loose tooth?
No.
Okay, have you had any hot or cold drinks for the last 20 minutes?
No.
Okay, that's good. So I'll be placing a disposable single sheet on my probe and put it under your tongue. Okay, thank you. So your temperature is 36.8, which is within the normal value. I'm done with everything. So Marinka, I am done with the assessment with you. So what I can see is that for your GCS, you've got a score of 14, which is 1 point lower than the usual value, which is 15. What I'm going to do is I'll be informing the doctor about this, and I'll be monitoring you every 30 minutes. Is that okay with you?
Fine.
And for the vital signs, I'm happy with the result. So I'll be monitoring you every hourly, and I'll be informing the doctor about this as well. For your pupil size and reaction, both pupils are of the same size, and they're both reactive. And for your limb movement, I'm happy with your limb movement except for your left leg, since I can see you have a fracture there. So what I'm going to do is I'll be monitoring you every hourly with this one as well. I'll be informing the doctor about this, and I'll also refer you to the physiotherapist and occupational therapist. Is that okay with you?
Okay.
Okay, thank you, Marinka. So Marinka, as I am doing my assessment, I can also see that I can also hear that you are talking clearly to me. You don't have any difficulty swallowing, and no obstructions on your tongue. So your airway is good. And for the breathing, I have checked for your respiration rate, which is 18. It is within the normal value. And you have normal breathing patterns. There's no seesaw movement of your chest, and that you are not using accessory muscles when you are talking with me, or even when you're just breathing alone. And I can also, there's also no adventitious sounds when I'm listening to your breathing. Do you have any difficulty of breathing as of the moment?
Not really.
Okay, that's good enough. And for your circulation, I'm very happy with your heart rate, which is 94, with your blood pressure, which is 128 over 80, and also with your SpO2, which is 99%, which is within the normal values. And I can also feel that your pulse in your radial and brachial artery are very good, they are bounding, and that your skin is warm to touch. Okay? And the next one would be, I can see that you have a fracture on your left ankle. Is that it? And is there a problem with your mobility as of the moment because of that?
Yes, I could say, because I can't walk really independently, and I think every time one of the nurses coming and assisting me.
Okay, so do you think that when you're going to the bathroom or maybe doing some personal hygiene or dressing, do you need some assistance with that?
Yes, at this moment really.
Okay, so what I'm going to do is I'll be placing this call bell next to you so that when you need anything, you can use that call bell to call our attention. Is that okay with you?
Fine.
And do you also want me to refer you to the physiotherapist and occupational therapist?
It would be great.
Okay, that's good to hear, so that we can also determine what kind of assistive devices you can use during your stay here to get you more independent as time goes on. Is that okay?
Thank you.
And I can see in your admission document as well that you have a head injury, which is, I can see that the dressing is a little bit soaked already with the blood. So what I'm going to do after the procedure will be, I'll be changing the dressing to a new one. Is it a bit itchy?
Yeah, I feel like a bit soaked. I can feel the wet.
Okay, so after the procedure, I will change the dressing for you. Is that okay? So this, other than the wound on your head and your fractured left ankle. Do you have any other wounds or bruises in your body?
I think there were some lacerations on my left thigh as well.
Okay, left thigh. So later on, I will be checking. I will be asking you to remove your coating so that I can assess as well and inform the doctor about the situation of your left thigh. Is that okay?
Yeah.
How about some rashes or erythema in your body?
No, nothing else.
Okay, that's good to hear. And I can also see that you have medication. You've been taking medication called levothyroxine.
Yeah, because I've been having my past medical history, which I'm existing right now with the hypothyroidism.
Oh, okay, that's it. So I can also see that since you're taking levothyroxine, it can also affect the weight of your body, and you have a very high BMI or body mass index. Have you? Can you please tell me with regards to your diet, what do you usually eat?
I really don't have a healthy lifestyle of having a good eating habits. I just go most of the time with some frozen foods.
Well, as of the moment, because it's not very good for your health as well, the diet that you are taking, is it okay for me if I refer you to a dietitian or a nutritionist to help you aid in taking healthy diets? It can also help reduce your weight and give you a healthier lifestyle.
Yes, I would like to give a try.
Okay, that's great to hear, Marinka. I'm very happy that you are very cooperative with the treatments that I'm giving to you. And I can also see that you're a smoker.
Yes.
How many packets of cigarette do you smoke in a day?
One pack per day?
And do you have any plans of quitting smoking?
Not surely at the moment.
Okay, so once you're ready, just inform me. I can give you a leaflet with regards to smoking cessation. And if you want some alternatives with your smoking, I can always provide you as well. Is that okay?
Yeah.
And I can also see that you have quite a lot of intake of alcohol in a week.
Yes.
And do you want to at least reduce your intake of alcohol?
Maybe that'll be a
Yeah,
good
it can
try.
also help with your diet and in reducing your weight.
Yes.
Is that okay with you?
Maybe.
So if you, since you're interested in reducing your alcohol intake, I can always refer you to the alcohol liaisoners so that they can help you with your control of alcohol intake. Is that okay?
Yes.
Okay, that's good to hear. Do you have any other concerns during your hospital stay, Marinka?
Because I'm just worried. I just came here straight after the fall.
Yes.
My two little ones. And I think my husband is there to take care, but still I'm worried. How are they coping up?
So with regards to that, do you have any other family members do you want me to contact to help your husband take care of your children?
I'm not sure whether it is on the case notes. Do you have my mom's number?
Yeah, I think it's included here on the paperwork. Your
Okay.
mom's number. Is it okay for me to contact your mother?
Yes.
Okay, so after this procedure, I will make sure to contact your mother to assist your husband in taking care of your children.
Oh, that would be great. Thank
Okay.
you.
Is there anything else, Marinka?
No.
Okay, that's good to hear. So with regards to your pain, it's to the same score as 5.
Yes.
Okay, so I'll be giving you analgesia after this. And are you comfortable with your position?
Yeah.
Do you need anything? Do you need to go to the washroom?
Not now.
Okay, I'll leave you the call bell with you. So if you need anything, just press the call bell and I'll be here shortly. Is that okay?
Yes.
Okay, thank you, Marinka. So I'm going to remove my PPE.